Good morning, everyone, and welcome to Repetitive Strain Injury Awareness Day 2024. My name is Lisa Hood-Cooper, and I'm one of the nurses here at the Occupational Health Center. We are delighted to have Dr. Monique Gignac and the team from the Institute for Work and Health joining us today for a presentation on disclosure and accommodation planning, a new approach and interactive tool to support workers with chronic and episodic disability. In this session today, you will learn about the award-winning and evidence-based job demands and accommodation tool, or JDAP for short, and how it can support workers and organizations to identify practical work-related support strategies and accommodation ideas for workers with chronic conditions and disability. So some housekeeping points before I introduce Dr. Gignac. We will be recording this presentation, and this will be posted on our website, probably within the week. We ask folks to use the chat to submit any questions, and we'll be monitoring those, and we'll have a short Q&A after Dr. Gignac's presentation. We also have the ability to send you some of the slides from today after the presentation as well. So as I mentioned, the first half of the session this morning will be a presentation by Dr. Gignac, followed by a brief Q&A. We will have a short break after the presentation. And then following the break, we'll have an opportunity for further sharing and dialogue that will occur in breakout groups. We will have facilitators assigned to each group to sort of guide discussions. And the breakouts will take about 20 minutes. And then the plan is for all of us to come back to the larger group for further discussion with Dr. Gignac and the team. We also have a raffle at the end of the session today for a gift bag after the breakout. So we ask that you be present to claim your prize. And we will likely do the draw for the gift bag somewhere between 11:15 and 11:30. And so for folks interested, the gift bag includes the following. We have a coffee and a tea mug and a journal from the Human Rights Museum. We have a set of boxed note cards from the Winnipeg Art Gallery. We have a sweater from Safe Work Manitoba, chocolate caramel popcorn with pretzels and chocolate from our local chocolatier, Decadence Chocolate. And last but not least, a package of coffee from Tom Bargain Coffee Roasters. So stay with us to claim your prize. We would like to acknowledge that we are presenting this session on Treaty 1 territory, where the Occupational Health Center is located, the traditional territory of the Anishinaabe, Cree, Oji-Cree, Dakota, and Dene peoples, and on the homeland of the Métis Nation. Occupational Health Center acknowledges that we are all treaty people and recognizes the history and the impact of colonization on Indigenous people. We commit ourselves to active accountability, to justice, to equity, and to reconciliation. And for those folks in the audience who are not aware of who we are and what we do, the MFL Occupational Health Center was established in 1983 to meet the need for quality, accessible, and comprehensive services on workplace health and safety. And that need continues today. We help workers, employers, and joint health and safety committees to improve workplace health and safety conditions and eliminate hazards. Our services are available free of charge. So please check out what we have to offer on our website at ohcmb.ca. So finally, before I introduce Dr. Gignac, we'd like to take a moment to get to know folks here in the audience today, because I believe we have quite a number of people joining us. And to help us with that, we have two polling questions that we would like to invite you to participate in. And please note that the polls are anonymous. And before you answer the question for the first question, I want to briefly just define for us episodic disability, which will help you with the question. Episodic disability is really a condition that might be recurrent, progressive, and may fluctuate and come and go. So in other words, you may have long periods when you are doing well, and other times when your illness might flare. Many episodic disabilities are unpredictable. They might be invisible to others. And examples might include things like depression, anxiety disorders, arthritis, chronic low back pain, long COVID, to name a few. So with that, the question that we'd like to ask in the poll, and again, it is anonymous, please indicate which of the following descriptions you most identify with.
Safety.
You are a supervisor or manager. And I'll just comment if folks, because we have quite a large audience today, if folks can just mute themselves if at all possible, that would be so much appreciated. Thank you. So again, are you a supervisor or manager? A supervisor or manager with experience in dealing with an episodic disability, that might be yourself, or it might be an employee. You're a worker or a staff member, or you're a worker or a staff member with experience in dealing with an episodic disability. Or you'd rather not say. I'll just wait a little bit. I think folks will also be continuing to join with us. We wanted to start right at 9:30 today because we have a bit of a packed schedule. So I'm going to just read, just give a few more minutes, and then I'll read out the answers just because we're recording this as well. So we have about 19% in the audience that identify as a supervisor or manager. 17% of the supervisor or manager with lived experience dealing with an episodic disability. The largest group today with us is 42% workers or a staff member, and 17% a worker staff member with lived experience dealing with an episodic disability, and 6% have declined to say. So thank you for that. Our next polling question and our last polling question is this one. If you had an episodic disability, how comfortable would you feel in initiating an initial conversation with a supervisor about an accommodation need in your current workplace? And just to be clear, we are not asking how comfortable you are about disclosing a diagnosis, but how comfortable you are having a conversation about an accommodation need in the workplace. So I'll give folks a little bit of time to answer that. All right, so I'll just read out the questions here. We have the largest, actually 38% said they would be comfortable having this discussion. 21% said they would be uncomfortable. Very comfortable, 19%, neutral, 7%, and 14% would be very uncomfortable. I think this question and topic is an important one. And as Dr. Gignac will likely point out in her presentation, we know that people living with chronic disabling conditions are often unsure whether or how to communicate workplace support needs. We also know that conversations around workplace accommodations are made easier in high-trust workplaces that also demonstrate ample psychological safety. And we will be exploring this topic further today in our breakout sessions later today. So finally, it's my honor to introduce Dr. Gignac. Dr. Monique Gignac is a scientific director and senior scientist at the Institute for Work and Health and a professor at the University of Toronto School of Public Health. Her research expertise is in the area of health and social psychology, including psychosocial factors like stress, coping, and adaptation, and their importance in understanding the impact of long-term conditions on the lives of adults across the life course. So without further ado, I will pass the mic over to Dr. Gignac, and welcome.
Thanks very much, Lisa. And I think we've heard enough of my last name, so Monique is fine for the rest of the day. Thanks so much. I'm just going to share my screen here. Hopefully it will all go well. Share. Let's see if I can get it in presentation mode. All right, hopefully that's in presentation mode for you and you can see the slides. And thanks, Tiffany, and I will get started. So yes, today I'd like to talk a little bit about disclosure and accommodation planning and some new interactive tools that we've developed to address this area. I want to just note that this has been a very large team effort to bring these tools to the forefront and to also kind of do the research behind the tools. So the team here, I've listed a lot of names. I don't know if I'm getting, someone's got their mute off or if I'm getting some back, but if you can mute yourself, that would be terrific. So we've got a lot of different expertise on the team. We have occupational therapists, we have clinical psychologists, physical therapists, occupational medicine, we have kinesiology and ergonomic expertise. So a lot of different people who have brought skills to developing the tool. We call ourselves, by the way, ACE, Accommodating and Communicating About Episodic Disabilities. This is a large partnership grant, and I'll talk about the funders in a moment. We also have, in addition to the research team, a number of different organizations who've been involved from the outset. That includes, of course, the Institute for Work and Health, but also a number of health charities working with different communities. And we also have people with lived experience on an expert advisory board who have been helpful as well. Our funding has come mostly from two federal granting agencies, the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research, although we did receive some developmental funds initially from Canada Life, and we've had some small amounts of money from Mars and Employment and Social Development Canada. So that's just sort of the big picture of who's been behind this. It's a lot of people over a lot of time. I want to start actually with my takeaway messages, and they are, so that'll help kind of guide us where we're going. But people living with chronic and episodic conditions causing disability, as Lisa said, they're often unsure whether or how to communicate workplace support needs. And I'll give you some numbers to see where you fit with the polls that we took earlier, how others feel about disclosing in a bit. Workers' workplaces, various disability service providers, health and rehabilitation professionals, and others often report needing more information about types of support that can help meet job demands and sustain employment. And so we've created this job demands and accommodations planning tool, or the JDAP, to try to provide some practical support and accommodation ideas. Early evaluation of the tool has been quite positive, and I'll come back to that at the end of the presentation. But let me sort of start now at the beginning, and I won't spend a long time here because Lisa did a nice job already describing to you what we mean by an episodic or a dynamic disability. These terms are changing, they're in flux. I don't know if we're going to land on episodic or dynamic or intermittent, lots of different words being used out there. But essentially in Canada, we have about 8 million people. These are Stats Canada numbers that came out in December of 2023. 8 million Canadians are reporting living with a disability. Some findings from a couple of years earlier suggest that 60% of these disabilities are of this episodic or dynamic nature. So people will have a period of a month or sometimes years with few, if any, limitations, and then they can have an episode or a flare or recurrence of a condition. Sometimes, as you know, a condition can be getting worse, so it's a progressive condition, and some people just have a lot of fluctuations. In addition to that sort of episodic nature, many conditions are also, these conditions are also unpredictable and invisible to others. So people can do everything that they should be doing and still have a flare at times that they don't expect it. And also others may not be aware. So there may be some signs or symptoms that a person doesn't seem to be themselves, but somebody may not be sure if they haven't been told that this person is living with a health condition. As I said, I've mentioned, or as Lisa mentioned, there are a number of sort of common mental health conditions and many physical conditions that fit this kind of episodic nature. There are some here on the screen. Some formerly life-threatening conditions like HIV and some types of cancers are now being seen with treatment to be more of an episodic condition. And long COVID, well, we're collecting data, many people are collecting data, and it, we'll see, but it seems to have some characteristics of an episodic condition. So what does this mean for the workplace? This changing and unpredictable and invisible nature of many disabilities really create challenges in two areas. The first is this disability communication, disclosure, and the protection of privacy, and also in providing support or accommodations to maintain productivity. So as part of this particular team research that we've been doing, we've basically summarized, I would say in a very simple graphic, something that's, as you know, is very complicated. But essentially workers are thinking they have a problem or a support need. And the two questions we hear most are, should I say something and what can I do? And so this is where we have been working. We have two tools that we are creating. One is called Decide, and it's a communication decision support tool. And the other is the Job Demands and Accommodation Planning tool. So I'm going to focus on the JDAPT. The Decide tool is actually not available quite yet. It's being programmed. It will be available later in the spring. It doesn't tell people you should or shouldn't communicate, but it helps people think about what the issues are and then provides them with some information back to them to kind of help make decisions. Regardless of whether or not people decide to say something or not in the workplace, the JDAPT has a number of strategies that help people work through that and can also be a first step in helping people think about how to communicate or what they can do. So I will, as I say, focus on that tool, but let me give you just a little bit of the research behind some of the disclosure to kind of bring that a bit more to the forefront. So across several Canadian surveys, and I'm focusing on Canada here because legislation differs in different countries. And so in some places, you're really much more required to disclose information than in other countries. In Canada, as you are probably aware, you don't have to disclose a diagnosis or symptoms, although you may be asked for verification from a health professional, and that information would be kept confidential. But in surveys we're finding here in Canada with about 3,400 people, anywhere from about a quarter to nearly half of participants who are living with a physical or a mental health condition say they have not shared any information about their health limitations at work with their supervisor. There can be a lot of reasons for that. One of the most common, actually, because these are episodic conditions, is that at the moment, I don't need anything. I'm fine. I'm not having an episode. I don't need to say something. But people can also say that they have found ways to manage their condition, so they don't need any support at work. And then, of course, it ranges into concerns about sharing, what this will mean, gossip, and other things. So when we look at disclosure decisions, we also don't see a single correct decision. Some people who have disclosed will say that that was the right decision for them. They got that support they needed. They got that greater understanding. Other people will say they've had some negative outcomes, so they feel they have to prove themselves all the time, or they've experienced stigma or gossip or a loss of reputation as a good worker. So sometimes people think, well, then I won't say anything. And that may result in something positive in the sense that you have less stress, less concern about how others view you. But of course, the negative side of that is that you may not get that support and you may need that. And there can also be misperceptions about what's going on and reasons for job difficulties. What I mean here is that we hear, particularly with chronic pain, and mental health conditions, that people will, as they move into an episode, almost start to leak symptoms. So people are noticing something is not the same, something is different, it's changing. And if they don't have information about what's going on, nothing's been disclosed, they can assume things like, well, this is not a good worker, they're moody, they're unmotivated, they just don't care about their job, they're not a good performer. So that's what we mean about misperceptions that can come about if someone doesn't disclose. In building the tools that we've been looking at, one of the things we did recently, and we've done a number of studies, we've looked at other people's research, is that we conducted a survey with about over 700 workers who were living with a physical or a mental health condition, sometimes both, that caused disability at least some of the time. And these are the big areas that people use to make a decision. And I just want to sort of highlight how complex it gets quite quickly. So people will think about what their needs are. And this is a big factor in whether or not people share, if there have been changes to their health, or to their job demands or performance, or if they feel they need some help coming up, or they have safety concerns. Sorry, somebody has their microphone on. Devin, Mr. Penner? Sorry, I don't know, Tiffany, if you can turn the microphone off.
It depends what you got to diagnose it, right?
Okay. There, I got muted too. Okay, I hope you can hear me. I'm back. So sorry, let me just go. Something has now happened to my screen sharing, Tiffany. I can't seem to advance my slides. Oh, there we go. Okay, sorry, we're back. So need for support is something that's a big factor in terms of making a decision. People will also have goals in making their decision. So they may want information or access to support, but sometimes that's not the goal. Sometimes the goal is to just avoid problems, you know, to protect reputation. So it's important to find out what people are looking for. People will also have their own preferences and values. So some people feel they have an obligation to share. Others will value their privacy. They'll want to control information, or they'll have had positive or negative experiences in the past. And then there are, of course, lots about the organization that we need to understand. So what's available in terms of benefits and sick days and accommodations, and then how do people feel about the culture in their workplace? So in this particular study, we asked a lot of that information from individuals. What we found from this sample was that about 56% of people said that they had considerable needs for support. Things were changing with their health, or they were concerned about the future, or things were changing with their job. Sometimes there were even safety considerations and concerns. At the same time, we also found that sharing was seen as helpful if you had accommodation and information needs. And about 70% of people said they had a number of supports. They had an HR, or they had benefits they could access, paid sick days, and so on. So it seemed like there was really a foundation for support in this particular sample that would suggest that sharing and you know, to meet accommodation needs would be useful. But when we looked at some of the other things that people were telling us, we could see how complicated it was getting. So for example, people's top goals were not usually getting accommodation information needs. They were protecting their jobs. I need this job. I need to protect my financial security and my reputation. And people didn't think sharing would be helpful there. About 30% of the respondents in the study said they were willing to share and thought it was important, but more than a third were reluctant to share. They could see the good and the bad. And about they just felt it was not a good idea for them to share. And about 34%, another third, were unsure. So they could see good and bad in sharing. Also, despite 70% of people saying that they had a number of supports available in their workplace, 20% only reported a positive culture. We had another 23% who were unsure or ambivalent, and a full 57% of people in this study said that they felt the culture was not conducive to sharing their support needs. So that, you know, raises a lot of concerns about how do people get support if they're not really wanting to share. And it really starts to show how complex the decisions are. If you're like me, it's hard to hold all this information in your head. And that's partly why we wanted to create this Decide tool that will be out later. So this is a bit about the worker perspective. I'm just going to tell you a little bit about workplaces. So we've done some studies, as have others, with similar findings. asking people, we call it our key informant research, asking people whose job it is to support workers, people like yourselves, what they believe some of the key issues are and the challenges to disability support. This was a qualitative study, so we had fewer respondents, but really in-depth interviews. The people in the study, there were 27 of them. They were supervisors or HR, they were disability managers, they were occupational physicians or nurses, they were union representatives and labor lawyers. And we asked them about, as I said, the different issues going on in their organization. There were 7 big themes that came up. I won't go through all 7 of the themes, but this study is available in open access if you're interested in finding out more. I'm just going to touch on 3 of them. The first was workplace culture, came up here again. Most of the organizations we spoke with they didn't call it a medical model, but I would call it the sort of the traditional model where it's important to verify that a health condition is real. And you do that by including health professionals. So getting some notes, doctor's notes, getting input on what's needed in the workplace. That wasn't what all organizations were doing, and many of the organizations were noticing that these models weren't working as well as they hoped, and there were a couple of reasons. One, the way the current system is right now, it was taking a long time to get notes, and sometimes not from the people that an organization might want. People just didn't have access to health professionals quickly. And so the delays were really eroding trust when people needed to do something quickly. And then sometimes information came back, very often, and it wasn't particularly useful. So there was a recognition that health professionals obviously don't know the workplace as well as the workers or organizations. And so their suggestions weren't always either amenable or easily to implement. And so there was a real problem here. A second theme that came up was that individuals often had misgivings about one another. So often there are a lot of people involved in support, and there's a recognition that this needs to be the case, but there were concerns about others' skills and their training and motivation and involvement. And I would say supervisors took a big hit here. Because there was a sense that they often don't have the training, and it can be sort of haphazard or idiosyncratic in terms of the support that was provided. And there wasn't this kind of level playing field that people were all starting on. But other groups also there were concerns about. So people were concerned that HR felt more like they were there for the organization and not for the worker. They also sometimes were better with forms and not knowing what to do. We had, health professionals, again, clever people, but don't know the job. So lots of people being concerned about the skills of others. And then finally, disability as a performance problem came up, where it was recognized that formal communication is often occurring because of work absences. So a worker will find themselves in an attendance management or an attendance support program where they're sitting with HR and a supervisor explaining why they're essentially a bad worker and disciplinary actions are needed. And so now disability has been recast as a performance problem. If a worker says something at this point in time, it's sometimes met with skepticism, or it's hard to get things back on track. That this is now a disability support issue. It's not a work performance issue. So those are some of the themes that came up with organizations. And I'd say the bottom lines coming out from our research and others' research is that workers are really looking for guidance on whether to communicate, how to get support if they don't want to share information, as well as when they do, and what they should share. Workplace professionals are really looking for a transparent, consistent, and a comprehensive approach to assessing what they know are individualized and complex needs, but something that would help them to start the process in ways that people feel are fair. And everybody, of course, would love to have more practical support and accommodation ideas. So this is where we stepped in with this JDAP tool that we wanted to create. Our goals were really to adopt a prevention and support framework. In other words, we wanted to try to be more proactive and less crisis focused, where you end up in these performance problem areas. We recognize that we would be integrating with existing support processes and aren't wanting to replace those, but want to enhance them. We wanted to be able to provide some practical ideas to meet work demands, be really relevant to diverse jobs and disability types and sectors. We wanted to promote discussion and brainstorming because obviously you can't have one tool that will fit everybody's needs and job. We wanted to, of course, improve the process and outcomes. Lots of things out there that give you lists of do's and don'ts. And so we were really looking for something that was more interactive and accessible and, of course, evidence-based, and something that would protect privacy, since that came up so loudly and clearly from workers that this is something we needed to do. So the way the tool works, and I'll go through it a little bit now more in detail, is it focuses on work demands that are challenging at times or regularly. It doesn't ask about health or a disability diagnosis. It doesn't ask about symptoms like fatigue. It focuses on the job demand. It takes a user through a series of simple questions about job tasks and working conditions. And it then provides, in any area where somebody says they're having some difficulties, support ideas that are relevant to those particular job demands. And we hope that these will help then generate some solutions or some new ideas that could meet a worker's needs. It can be used by a worker on their own or to discuss support needs with others and focus on solutions. Back in 2022, we actually entered the prototype into an inclusive design challenge for people living with disabilities. This was sponsored by Mars, which is a venture capital organization, and CIBC. And the JDAP prototype actually won the grand prize, which was terrific, but we are still working on enhancing it as we move forward. So in the tool itself, there are 24 job demands and working conditions, and they're organized into 4 areas. So there are questions about the physical demands of work, cognitive or thinking demands, working with others, and working conditions. So this is not meant to replace, a physical demands, specific to a job kind of assessment, but it has broad questions with lots of examples. There are 3 versions of the tool. So there's a version a worker can fill out to self-assess their own job demands and challenges. And then there are 2 organizational versions. So there's a version that could be completed by somebody who is familiar with a worker and their job. So that can be an occupational health professional, that can be a supervisor or HR. It can be done on their own if they know the worker challenges well enough and their job, or it could be done with the worker if they agree to sit down together. And then there's a 3rd version we were asked to create because we were hearing from some organizations that they didn't necessarily have a person in mind right now, but they were trying to make their workplace more inclusive and accessible. And so here you can fill it out. It's a kind of a stripped down version, but you're focused on the job and ways that it might be, ways to make it more accessible. So thinking about, the worker for a moment, what they would be asked for each job demand is, first of all, is this an important part of your job? Or for the other versions, is this an important part of this job? The person if a person says, no, it's not really an important part of the job, they move to the next question. If they say yes, then the worker is asked, is this difficult at times due to your health? And does it change over time? Let's say the supervisor or the health professionals are asked, is the worker having difficulty with the job? They're not asked to attribute it to their health, just are they having difficulty? And again, is it changing? Once a person has gone through the 24 job demands, they're then given a summary report of what we heard. And again, any area that is challenging is linked to support strategies that a person can review, and they can save a PDF of the materials as they go through. So I'm just going to show you some screenshots, a few screenshots, and kind of walk you through. I'm not going to go into details about them, but just to kind of give you a better sense of what it looks like. So the tool, there is a link for it there. It's free to use, but there is a landing page, and you would see different versions of the tool. So you've got here the JDAP for workers. There's an English and a French version. So we have English and French for all the versions that we've created. And then you would go down on that screen and there would be the organizational version as well. You would see an introduction page once you pick the tool you want to use. And it's got a lot of words here, but the tool's so simple you could skip all of this. But it talks about how does the JDAP work, how does it help, what it's not, so it's not legal advice, and who created the JDAP. From here, you move into some brief instructions that are similar to what I went over a moment ago, that, is this an important part of your job? How would you rate your ability? Is it difficult? And does this change over time? And you can see across the top, there are the 4 domains. What we hear from people is it's very simple. There's a real pattern to the questions. And so it's easy to follow. And we've heard that from people with conditions like ADHD, as well as conditions where there's a lot of fatigue associated with them. So these are 2 screenshots. Again, apologies. I know you can't read them all. You don't have to. But on the left, there would be some questions about physical demands. Again, if a person says it's not important to the job, they move on. If they say it is important, or they're not sure, on the right side there, you can see that you can open up the examples of what we mean. And then if it is important, you can rate how difficult it is, or whether or not you have changes. Different questions, of course, for cognitive demands, and here's the working conditions. And I'll just pause here because another thing that you can do is you can save a draft. So if you don't want to do the tool all at once, you can save a draft and come back to it later. Once you submit it, though, we don't keep any copies. So you can save your PDFs. That's for you to do. You can also add a job demand that you don't think is being covered by the tool. So here somebody has written in dry air is a problem for them with their health condition. This is helpful because the tool itself kind of, we hear from people, helps people to kind of organize what the areas are that are problematic. Now, unfortunately, if you type in a demand, we don't have strategies to give you to deal with it, but it's something then that you can start thinking about. And there may be existing strategies that are part of the tool that would help with this kind of issue as well. So this is just an example of the summary that you might get. Again, these are 2 screenshots. Just focus here for a moment. You'll see a large 16 of 24 on the left. What this means is that this fictitious user has said that 16 of the 24 job demands are relevant to them, to their job. And then on the right side, you see some bubbles. There are some turquoise bubbles. One of them says 8 of 16. So this fictitious person has said that 8 of those 16 job demands that are relevant to their job are difficult for them some of the time. And 7 of them are not constantly difficult. They change, they vary. And then the remaining bubbles are basically breaking it down into the physical, cognitive working conditions, or working with others and working conditions. So just to kind of give you a sense, this is the first piece of summary information people get. What would happen now is that for the 8 areas of work that are challenging for this user, they would start to get now the ideas and strategies that they might use. So this is not what it looks like on screen, but just to kind of orient you to it. If a person had said physical endurance or stamina, which is on the far left there, is a problem. It's part of their job and it's a problem for them. They'll get some strategies of things they can do on their own, things they could try at work. They may not need permission. They may have to ask for some help, and then more formal accommodations. For every one of them, there are examples, more concrete examples of what we mean to really help people start brainstorming and think through things they can do on their own or with others. Once you change to a different task, like concentrating for long periods, you get different types of strategies, and again, examples of each. And this is working with others. Again, it's the same kind of format for all of it. Lots of strategies you can see are coming up. So a person can actually go through and click on those areas that they feel they're most likely to be successful in being able to use or get permission to use in their workplace. So you can create a personalized list of the strategies that might be most helpful for you with a condition. So at the end, you are those little arrows pointing down. It allows you to save different amounts of the information that you get on a PDF. So if you want to just save your job demand summary, you can. If you want to save all the strategies, you can, or your personalized list, you can do that as well. So that's the tool. Just another kind of quick note about what went in and what didn't go in. We did have some rules for developing our strategies. So we absolutely did want to emphasize strategies that would prevent harm, promote individual capacity, and manage different personal, social, and environmental challenges. Don't want to put this all on the shoulders of the person with the condition. Want to recognize that the workplace creates problems as well and how we can overcome them. We want it to be concrete and specific, so we don't say things like, oh, you should just avoid stress at work. It's, sure, not very helpful. We wanted to find a range of examples to suit different types of jobs and needs and provide strategies that a person can implement on their own, as well as supports from others. So if a person isn't ready to share very broadly, there's still things they can be doing. We do provide some lifestyle strategies, but our focus is mostly on the workplace. So we will say, you might want to consult with a health professional for more information. You might want to, get more rest and those kinds of general lifestyle. But we didn't want to put the onus as much on the worker here, or the person with the condition. We really wanted to start focusing and provide more strategies workplaces can do. So lots of good strategies out there. Make large meals and divide them into portions to help deal with fatigue. Great strategy, but you won't find it in the JDAT. There are things that we don't do as well. Obviously, we're not providing clinical rehabilitation or legal advice. We don't name any products or brands. So we might say, look into getting an ergonomic chair, but we won't say which is best. We are trying not to be too prescriptive. So we would never say, you should work 4 hours a week for 8 weeks and then increase to 6 hours. We tried to avoid strategies that we thought would be cost prohibitive for most organizations. And we avoided strategies that didn't link to a specific job demand. So there might be things that would be helpful, like starting a support group in an organization, but it didn't link directly to a job demand. So we didn't put it down. So that's some of our reasoning behind what went in and what didn't. So I'd like to just finish, and I've been talking a lot here, with a little bit about evaluation. So we have, as we've been building the tool and delivering the tool, we initially did a needs assessment to see what else was out there. We have done what's called sometimes a formative evaluation or some sensibility testing of the tool. We've done some outcome effectiveness, and we would like to do some more implementation work as we move forward. But I'll tell you a little bit about the formative evaluation and the outcome effectiveness. So for our initial testing, what we were trying to do here was get a sense of how comprehensive, relevant, feasible the tool was. So this was really in-depth testing. Julie Bowering and Sabrina Tonima are here today. They did interviews with people. They sat down and went through every single question. Do you understand the question? Are the examples helpful? Should we add some questions? So very labor intensive with our participants. And our goal was that that 70% or more of participants would say, yes, this looks relevant, or yes, this is comprehensive. I can't think of other questions to add. We had, for the study, the initial study, we had 46 workers who had different physical and mental health conditions. We had 23 organizational representatives, and we had a whole range of different job types and sectors. Overall, our sensibility assessments far exceeded 70% for most categories. The one exception was comprehensiveness, which was right around 69%. So we added 3 items, 3 job demands actually based on this initial testing. But here are some quotes from participants. It seemed like you covered every piece, whether it was the physical piece, tedious work that's happening over and over again, or working long hours, traveling. So you've covered everything. And that was a baker living with ADHD and a skin condition. Someone else said, there were basically all of them that I go through in my job. It's basically everything I do at work. That was a truck driver with Crohn's disease. And someone said, I go in and just say, I'm dealing with a mental illness. And my boss says, what do you need? And I say, I don't know. I think the JDAP might be better to help me understand actually these three aspects of the job are what actually are difficult for me. So let's think about what we do with those. And that was a government worker living with depression and PTSD. And so you can imagine I chose these. These are very representative of the types of quotes we heard, but I chose them because the people speaking were living with really quite different conditions and had quite different types of jobs. And so that provided us with some initial confidence that we were on the right track with something that could be broadly relevant. I mean, obviously there could be a tool that's very specific to a job that would be even better, but that we had something that was broadly relevant to individuals. As I mentioned, we've also done some outcome evaluation. So here what we've done, and we're just about to publish this, the other study is published and is also available in open access if you are interested. We had 3 waves of data collection here. So we initially spoke to people, we gave them a survey, and we asked them a lot about their health and their job and their perceptions of working with their health condition. They had not seen the JDAP at that point. After that, we gave them the JDAP, they filled it out, and we asked them about their perceptions. 3 months later, at time 2, we followed up with everybody who we could and asked them, had they used the JDAP? And we got more information about work that was similar to what we had originally asked. And then 6 months later, or 9 months from the beginning of the study, we did the same thing. We went back. Have you been using the JDAP at all? How's it going at work? So we originally started with 269 people. We were able to keep 188 people in the study. That's 70%, which is terrific, actually. A lot of studies drop to fewer than 50% of their sample, particularly when you're dealing with people who are living with health conditions, where there can be a lot of change or, again, flares and episodes, and people have left and aren't able to participate in research. So what we found was that 70% or more of individuals had made changes using the JDAP to manage their work and health outside of work. And as you I was mentioning earlier, this is really what people want to do. They don't want others to know in the workplace. So we were glad to see people were finding things they could do. There were, though, about nearly 60% of people said they had made some changes to health, their work and health at work. This dropped to 43% at time 3. So we had asked everybody at time 2 and time 3, if you said no, you hadn't made any changes, why didn't you? And the reasons included, there was nothing in the JDAP that was of use to me. It wasn't relevant to my job, but also, and what turned out to be the reasons why people weren't making changes were largely over 40% of people said, right now I'm not having an episode or a flare, so I don't need it. Another more than 40%, about 45% of people said, the reason I haven't made any changes is that I found something and it's working, and so I don't need to use anything new. So I think that explains particularly some of that drop at time 3. And then there were also about 1 in 5 people said, I just don't want anyone to know I have any problems at work. So again, that reluctance to disclose. Almost no one said that they didn't find anything. I think there were only 1 or 2 participants said, I didn't really find something relevant in the tool for me. And then we also, because again, we know people are so reluctant to share, we were pleased that actually 21% of people, and this rose to 24% at time 3, said they actually shared the tool with others at their workplace. And so here are now just a couple of quotes here. It was empowering to see how much one can do on one's own, especially when I'm hesitant about being supported by HR. I used both the full and my personalized list of strategies and accommodations when I was informed that I would need to return working in the office some days a week. The suggestions in the material were very helpful. And I used a list of strategies and accommodation plans, plus the language of the job demand summary to help me request a workplace accommodations plan. These tools were critical in helping me explain how my disability impacts my work and allowed me to think about possible solutions. The plan is still being finalized. Without the JDAP, I wouldn't have had the confidence to go through with this intimidating process and advocate for myself in such an effective way. So again, we want to do more. This was just an initial study, but very pleased with some of the usability of the tool. So the last little bit of data that I'll give you today, as I mentioned, we asked people before they ever saw the JDAP to tell us about their job. We asked a lot of questions to get sort of background information about people in the study, but we asked them how confident they were that they could problem solve challenges related to their work and health. And this confidence is sometimes called self-efficacy. So how confident are you in solving problems related to your work and health? How confident are you that you can actually meet your job demands and get your work done? How confident are you that you can deal with emotional needs like stress and worries about the future? We asked about some presenteeism, how much difficulty are you having getting as much work done as others expect, and about work productivity problems. We asked about absenteeism over the previous 6 months. When we came back at time 2 and time 3, we found positive changes in the direction that we would like for all of these variables, and they were highly significant at p less than 0.001, so unlikely to be chance. So we saw increases. People said they were more confident in problem solving, meeting their demands and emotional needs. They were having less difficulty getting as much work done as others expect, fewer work productivity problems, and absenteeism had decreased as well. So those were very positive signs for us. But there's one last thing we can do, and that is look at effect sizes. And what this means is that you can have a change, and it could be a real change. It's not a chance change, but it can be small, or it can be larger and more meaningful, something that we would see. So if you have a number of around 0.2, it means that, okay, it may be real, but it's fairly small. Might not be something we would see. Numbers around 0.5, those are moderate changes. Those are more meaningful, more likely to be something that we would see out there. And then something around 0.8 is very large. It's very rare to see something like that in rehabilitation interventions. It's more likely something you would see in surgery or in a dramatic treatment. So what we saw here was that the absenteeism changes were smaller. The other changes tended to be moderate and some even approaching large, which was terrific for us. So we are doing additional analyses. I can tell you we've looked at gender, age, type of condition, whether someone's permanent or contract work or as a member of a union. We're not seeing differences. In other words, the JDAP seems to be working equally well for these different groups. We will do some additional research if we get funding to look more at adoption and reach, and always looking for ways to enhance the support and accommodation list. So if you do have a chance to go through the tool, and I hope you will, if you have ideas for things we should be adding as supports, please do let us know. So just to finish here, the English and French JDAPs are freely available. Please share them, try them out, use them, let us know what you think. We don't ask for any personal identifying information at all from anybody. People can download their responses, but we don't save anything. It gets cleaned or wiped 24 hours after 24 hours. The worker version in English has been available since March 31st. The other versions came later, with the last one, I think, coming out last fall. So it's still a fairly new tool. As of February, we had about 8,000 unique visitors to the tool. So these are people who not just landed on that first page, but actually started to make their way through the tool itself. We've had PDFs downloaded, about 3,900 PDFs downloaded. We've had about most of the visitors, not surprisingly, from Canada, but we've had over 2,000 from the US, UK, and Australia. And we've had a lot of other visitors coming as well from different countries. So we'll keep moving forward with this. I will stop now. And Lisa, I guess I should stop sharing my screen. Oh, there we go. There we go. Over to you, Lisa.
Fantastic. I'll take over right now, just to be brevity of time, because we want to make good use of it. So just real quick, I'll do my thank yous right now, Monique, and I'll just kind of preface some of the questions and answers that we're going to go through in the next little minute, in the sense that the best learning is when you use something and you play with it. So obviously I went through this many times, and I thought of myself as a worker with these issues. I thought of myself as HR manager, supervisor, trying to help somebody. And I thought of easy examples in my past, and I thought of some difficult ones. So I'll just say on that note, great tool, just nice and simple. Great tool. As an ergonomist, it was great to go through the different elements as a reminder of questions to ask and such. So for everyone here, all the little kind of questions will probably can be answered by playing with the tool. But also I was kind of quite busy getting the questions into Google Docs. So if I ask a question from the audience and already answered, Monique, forgive me on that. So let's begin. We got a few minutes then. Let me just go through some of the questions. All right. Obviously, this is not a physical demands analysis. It asks questions about the work, but it doesn't do anything specific, right? There's no specific weights or times or frequencies. Is that correct?
That's right. So again, I think it's meant to enhance what tools and practices are already there, and often is really great, as you say, for a reminder of areas and as a level playing field, and can be used sort of across a lot of different jobs. But yes, no, it's not a formal cognitive or physical demands assessment tool.
Okay, and as people go through it, they'll see what it's all about. All right, the next question is, I do remember that I could save parts of my report. So if I was a worker who wanted to share only pieces of the JDAP report with my employer, am I saying this correctly, that they can save only parts of it, or is it just a whole one big report on a PDF?
So you know that you can break it down into different parts. So you could share, for example, just the job demands difficulties that you are having and and how that changes. There's that summary. There's then the summary. You can have all the supports, or you can do a personalized one. So you could provide, here are some, ideas that deal with this particular job task, and share that. If you wanted to pick and choose certain job demands, you'd probably need to do that on your own, because it does sort of do all the job demands or none of the job demands. But certainly for the strategies, you can pick and choose.
Okay, great. And apologies if I missed this last part, but do you find right now that, even though it's new, do you find that more workers' unions are sort of bringing this tool forward, or is it more of the employer safety HR that are discovering this tool and trying to then use it in their workplace?
It's a great question. Because we're not saving data and asking who's using the tool, we don't have as much information as we would like. We're certainly speaking to a lot of people like you. So we're doing a lot of our outreach is actually at the employer level, and their use of the tool. We have had some conversations with union representatives, but need to do more work there. I think what we're getting now is actually a lot of sharing with workers. We've also had disability managers and others share out with their communities, and we have the health charities sharing with their communities. So we're not sure who all these 9,000 people are, but we're thinking, or 8,000 people, we're thinking that a lot of them are workers, but we know people have gone directly to the JDAP. We are hearing people finding about the JDAP too on social media. So I wish I could answer more about how it's percolating through the system. I don't really know.
Okay, wonderful. A nice comment about, I went through the assessment myself. Suggestions were very practical and reasonable, and lots of options, very thorough. But do you have any examples, real quick, if you can, of a very difficult case study that you heard about where the JDAP really helped an organization or a worker in that sense?
I'm sure I'll think of one at the break. I
Okay.
do know, but I will say we have had a number of people living with both physical and mental health conditions. So quite complex, quite exhausting, quite stressed, who have said that the tool has really been helpful to kind of organize what has felt overwhelming for them. So I can think of an example of someone with MS, who has talked about that and said that it was really very difficult what they were going through, lots of changes, and it just helped them not only at the first time they did it, but to go back to the tool as things were changing, to monitor, that they found this was really helpful to them as not a one-time out, with the tool, but multiple assessments.
Okay, wonderful. Another question. We're doing good for time, so this is great. What about the applicability of the tool for EAP adoption?
Well, that's a good question. I think it would be terrific. We have had some consulting firms contact us about using the tool. And of course, they're free to use it. We just say they can't use it in a way, package it up and charge people for it. But I do think it would be a perfect tool for EAPs to be adopting as, again, a kind of something that gets a worker and the workplace all thinking and understanding what the problems are and potential ways to go forward. So I think that's a good point.
Early assistance program.
Right. Yeah. An EAP is an early.
Yeah. Good. I saw that just came to the chart of the chat.
And I'll just quickly say it's part of the benefit packages that a lot of organizations have. It can give you access to a lawyer, to a physician, to different groups of people. Yeah.
Did I say early? It's employee assistance program. I think
Yeah,
I said early. Oh boy. Oh, the stress. Okay. Anyways, so I've just scanned the chats. I scanned the other questions. That's about it. Some other kind of questions that I think you answered. So that's good. So what's going to happen now shortly is we'll take a good break, 10, 15 minutes. And then we at the OHC are going to put people into different breakout groups, small numbers, and we're going to have a facilitator. So for example, I will be one of the facilitators, and one of our other group will be a note taker if we have enough people. And then we have a few questions to get people talking. All right, so we have some set questions, but the facilitator will be a little flexible and go from there. So that is going to be from let's just say 10:45 to a little bit after 11 o'clock. All right, so those are the questions that we're going to go through, get you thinking, and then take some notes. We'll come back and then we'll share some what our learnings have been, and then we'll kind of wrap up. And as Lisa said, don't go away for that fleece jacket and basket of whatever. I don't know, whatever it is, it's in there. I kind of heard Lisa, but I forgot already. All right, so very good. Just to confirm, JDAB is available. Yes, it's available to the public and such. All right, everyone. So go for a stretch break, clear your head a little bit, and please come back. We really want to get your feedback and have this conversation about this tool. Okay. All right. So we'll see everybody in just under 15 minutes at 10:45.